Hello, everyone. I'm Lisa Ling, and welcome back to The Road to a Vaccine, an exploration of the COVID-19 crisis and the global community's efforts to develop a vaccine against the disease. Today, we have a special episode on the relationship between patient advocacy, policy, and science, and the power that movements for change can have on public health in a pandemic like the one we are in the midst of now, as well as other public health challenges. Now, it's been a few weeks since our last live episode, so let's take a look at where we are now with COVID-19. With schools beginning to reopen around the world, debates about children and COVID-19 continue to rage. There is research that suggests children carry at least as much virus as adults. And in the last 2 weeks of July, almost 100,000 kids in the US tested positive for the virus, according to the American Academy of Pediatrics. COVID-19 cases in Mexico are on the rise, and Mexico is now trailing the US and Brazil in virus-related fatalities. Global COVID cases have surpassed 20 million. And in the US, we continue to see disproportionate effects in poor communities and communities of color. Disparities that have been reflected in some of this summer's Black Lives Matter protests and have really sparked much needed conversations about systemic racism within the fields of science and medicine. Now, COVID-19 has tested our science and public health systems, and we're seeing patients, doctors, and scientists discovering aspects of the disease in parallel in real time. During the AIDS crisis of the 1980s and 90s, it was patients who, in a race to save their own lives, pushed for patient-driven clinical trials, access to new drugs, and congressional funding for research and care. Now, in the midst of COVID, what is the role of patient advocacy in defeating this pandemic, and how can scientists and advocates work together? What can we learn also from patient advocacy movements of the past? Today, we'll be having two conversations with advocates who are creating change at the intersections of health, disease, human rights, and social justice. We'll look at this topic through two different perspectives, instituting change from within and advocacy through raising public awareness. Now, as always, if you have questions, we'll be taking them throughout the show, so please put them in the comment section and we will do our best to get to as many as we can. Now for our first discussion, creating change from within the system. I first would like to welcome Mary Woolley, President of Research America, that advocates for making medical and health research a higher national priority, and Sudeep Parikh, CEO of the American Association for the Advancement of Science, or AAAS. Welcome to both of you. First off, Mary, I'll start with you. How would you define scientific advocacy? Why does it matter? And what are some of the issues that the scientific advocacy movement is fighting for today?
Well, Lisa, first of all, thank you. It's a pleasure to talk with you. So scientific advocacy is like all advocacy. It's about making the case for something that's important. So when scientists make the case, they join with patients and others who want to be sure that science is, to borrow a phrase from the musical Hamilton, in the room where it happens. So it's in the room. Science is there when policies are being made. Science is there when funding decisions are being made. Science is there when healthcare decisions are being made. And science is there when all of us as individuals, for ourselves or our family, is deciding which steps to take to protect ourselves and those we love from a pandemic, who to believe. Following the evidence is all about science. So making the case for science is something that is not always comfortable for members of the science community. They haven't typically learned how to do that. But we believe at Research America that it's past time, and we know that more and more young scientists in particular are stepping up to do just that.
You mentioned the word evidence. It's a word used often in science, yet there are many people in this country, even elected officials, who are opposed to the science, who don't believe the science. How do you respond to that, or how do you work to overcome that, Sudeep?
Well, Lisa, thank you for inviting me. I'm happy to join the conversation. The way to do that is to build trust even before you need that conversation. As scientists, we often are joining the conversation when it's time to make a decision, and that's not the time to build trust. The time to build trust is before you need the conversation about decision making to happen. And so at AAAS, part of what we do is introduce scientists to journalists, introduce scientists to politicians, introduce scientists to seminarians to build that trust before we need to have the conversation about we need to wear masks, we need to do this, we need to take this particular decision. And unfortunately, you can't do that after the fact. You can't make those trusted relationships after the fact. And so even in the midst of a crisis, you have to build trust and shared common values.
Well, speaking of trying to do that before a crisis, you both and your organizations have been fighting for increased funding of science and medical research for decades. Now, because the US really hasn't had much experience with pandemics, at least in the last century, it seems like we have just jettisoned our ability to have a robust pandemic response. So how important is it to be proactive about looming pandemics and funding for health and medical research on the front end before it becomes a crisis? And how can we all better advocate for that proactivity so we don't get to this place again?
Well, you're right, Lisa, that's the goal we all share. We never want to see this happen again. And I would say that one of our long time now problems in this nation is that we haven't put the resources behind our public health infrastructure that it deserves. So right now, the CDC, for example, has a budget of about $8 billion a year. Now, that's a lot of money for any of us as an individual. But contrast that to the Department of Homeland Security, which is over $70 billion. It didn't even exist before 9/11. The point is that we're at a time now where we need to step up on public health. And CDC is a critical part of that infrastructure. It's not the only part. There are other federal agencies and there's our state public health systems. But if we can't reset our priorities now in a big way, we're going to miss out the next time there's a pandemic too. And we can't afford that.
You're so right. I mean, this is as much a national security threat as anything the military deals with. Sudeep, were you going to say something?
Yeah, you can actually see this happening. You can see the manifestations of these investments right now in front of us, right? So the innovation towards vaccine, towards treatments is moving unbelievably fast. The time scales have been reduced from years to months to weeks in terms of getting antibody treatments, getting potential vaccines into the clinic. And yet on the public health side, where there has been less investment, you see the failures. You see that lack of trust. You see the lack of relationships, the lack of reporting systems. And so it really makes the case for these increased investments. And this isn't going to be the last time. This is probably the first of many in our lifetimes. Not just public health, but other types of threats as well, climate change. So we have a lot to do in terms of making the case for investment in science.
Well, just the idea of putting science first and acknowledging the research that comes of it. What has COVID done for advocacy movements like yours, ones that have been pressing for greater funding for scientific research and advancement for so long? Mary?
Well, I think COVID has been a wake-up call for people on every level, their personal lives. For scientists who aren't in the infectious disease community, it's meant they've shut down their work. Cancer researchers, Alzheimer's researchers, diabetes researchers. It's had a terrible impact. And that has a ripple effect that means that it's affecting our families' lives in so many ways. So with that realization that, wow, everything can come to a screeching halt if we don't do better next time, we've got to build back in a way that makes science hum throughout across the sciences, actually, not only in the health and medical sciences. So we know at Research America that more and more young scientists in particular are saying, how can we help? What can we do? How can we become more effective at being visible and assuring the public that we serve their interests? And that's a key thing for scientists to convey. It goes to the trust factor that Sudip has mentioned too. To be able to say and convey, I serve the public's interest. Ask me questions. We'll talk things through. It's okay to be skeptical. That's the way scientists are trained, after all. It's okay for people to be skeptical, but it's also important to learn how to listen to experts and to follow the evidence.
Yeah.
You mentioned scientists wanting to. Oh, I'm sorry, Sudeep. You mentioned
Sorry.
scientists wanting to be more visible. Is that something that is not particularly common? My thought has always been that scientists have sort of been so focused on what they've been doing, on their research and so on, that they have not chosen to be as visible. How important is that for scientists to assume a more public role in communicating their research and advancement? Sudeep?
Yeah, it's incredibly important. And what you're seeing, particularly with this next generation of scientists, is a willingness to be there, not just in Washington, but in state capitals, in local government, in their places where they interact with other people their age. You're seeing this willingness to do that, and that goes back to building trust on shared values and shared understanding of one another. That's so important. It also has brought out this urgency to ensure that we are able to reach out across boundaries, not just in the U.S., but across international boundaries. So much of this research is taking place around the world, and if we're going to, cure cancers and treat COVID, we need the best brain power of everyone from the United States and around the world.
I want to remind people who are watching that we are taking questions. Put them in the comment section, and we will try to get to them when we can throughout the show. Mary, your website at Research America says, we have long kept a finger on the pulse of public sentiment. So my question to you is threefold. One, how would you describe public sentiment with regard to issues about the advancement of science, about the virus, coronavirus, and about the whole vaccine process?
Right. So thank you, Lisa. Yes, we have for 3 decades now been keeping a finger on the public pulse, and we're really inspired by President Lincoln, who famously said that public sentiment is everything. Without it, nothing can happen. Nothing good will happen without public sentiment, but with it, anything is possible. So we know, and this has been consistent for 3 decades, that the public does support science. When they have questions, it tends to be about specific aspects of science, and that's healthy and appropriate. So we know that, and this goes to that visibility point, we know that only about a quarter of the American public can name a living scientist. Now that may have changed since we've seen more scientists in the news lately, but it's a very small percentage. And only about half can name any place that science is conducted. Now that's stunning. That's a problem. It leads to people finding science mysterious and potentially having distrust in it. So we do know that people have questions. They want to hear from scientists. That point has been well made, I think. They want answers to questions. They want access, and they don't want to be turned away. Now, when I say they have questions, some of those questions are about vaccines. We've seen a disturbing trend in the percentage of people, even before COVID, who felt confident that vaccines were appropriate for themselves and for their children. It's very disturbing. It's been driven by a lot of factors, including social media, perpetuating a false claim that vaccines cause autism and other problems. Now with COVID, we're seeing in surveys that have been conducted by many organizations, actually, that there is continued skepticism about a vaccine. Some of that is about.
And Mary, do you think it's because of the pace at which this is all happening?
Yes, took the words out of my mouth. The pace of possible regulations that are happening too fast. There's a trade-off always with regulations of safety versus accessibility and efficacy. So there's a lot going on for the public. I think it's right for people to ask questions, And that's why it's even more important for scientists to be out there and visible and responding to those questions. And when I say scientists, I definitely include public health experts and physicians and other healthcare providers.
And here
We
you're
have questions
seeing
rolling in.
Lisa,
Sorry,
I was
Sudeep,
just
go
going to
ahead.
say, just as building on the HIV example that you gave at the beginning, this is where you see that leadership coming from the patient and consumer community. We have to treat them as they are equal partners in this. They are part of the solution to COVID-19. The 330 individual decisions that are going to be made in the United States on taking vaccine, on doing other things to protect their own health. That's a partnership. The patients and the consumers have a real voice in this, and we have to make sure that it's a partnership and not explaining to anyone or coming at it from the point of view of the ivory tower. We are part of this community.
We have questions rolling in, and Mary, you mentioned all of the misinformation that is percolating about vaccines and people's resistance to wanting to take it if it is developed soon. Joseph from Facebook asks, why is there so much misinformation when so many lives are at stake? Sudeep?
That's a great question. Why is there so much? Unfortunately, it serves some purposes. Sometimes there are what starts as conspiracy on the extremes of the internet gains a voice and gains traction because of the social media that we've all made a part of our lives, and that chaos can sometimes have there are people who are incentivized to make that chaos happen. As scientists and those protecting public health, we need to make sure that we can cut through that, and the only way to cut through that is by being honest and truthful every time we are talking, being able to point back to primary sources, and then being able to have relationships with other trusted people in communities that can convey that message. If you want to have your message believed, you need to have allies in a community that are believed by that community. And parachuting in is never the solution. It is reaching out to communities of faith. It's reaching out to trusted politicians. It's reaching out to doctors and clinicians in an area to actually make these cases, because just being a parachute on the internet just doesn't solve the problem.
Speaking of reaching out to communities of faith, we had Francis Collins, who is perhaps the most important scientist in this country, who is a man of a very strong faith at the same time. So maybe corralling him to talk about the intersection of faith and science could be really important. We have another question from Tatiana from LinkedIn, who asks, the pandemic showed us the problems in all countries regarding their health system. Do you think this is going to change after the pandemic? And will the most vulnerable have more access to healthcare? Mary?
Well, I certainly hope so. That is a lesson that if we fail to learn right now, we're just not listening. And by we, I mean people in science, people in public health, people in healthcare. It's revealed, the pandemic has revealed terrible disparities that we've tolerated for far too long. And those extend to systemic racial injustice as well as healthcare disparities. So people are paying attention, I'm happy to say, and what we need now is for political actors to pay attention also, because not all change and innovation comes from science. Some of it comes from policy change, and that takes the will of the public, first of all, to elect the people who are going to make those changes, and then secondly, the policymakers themselves. So it's time.
So how do you even begin to educate those elected officials and policymakers that scientific innovation matters and that increased funding should be directed to it? And what happens when you have those political leaders who just have a fundamental issue with science and just reject it altogether? Sudeep?
We have demonstrated success in this. I mean, Mary's activism with Research America over the last 30 years has made a real difference. And part of that is by building trust with politicians, showing concrete examples of how innovation has led to treatments and cures for disease, how it's led to growth in well-being for everyone, and growth in economic well-being for everyone. And that for everyone is really important, because if we don't do that, if it's really not if it's uneven in terms of the boats that it lifts, it becomes a very challenging message. And so that concrete example, for example, Taxol comes from Pacific yew trees, the bark of Pacific yew trees. That is something that is tangible, that says this was a drug that was developed for breast cancer, coming from basic discovery, or now to gene therapy and gene editing. These are concrete examples of hopefully technologies that will lengthen lives, make lives better, and bring economic benefit to the United States.
We've been dealing with this virus, COVID-19, for 7 months now in this country. It has literally wreaked havoc on our economy and taken so many lives. Now there's a lot of frustration, and in some cases there's a lot of fatigue settling in. How do we deal with that frustration and continue to urge people to heed the recommendations of scientists?
Well, it's life and death. I mean, I was in San Francisco during the HIV/AIDS crisis, and that didn't go away in a few months. And it was a very real thing. As then the mother of teenagers, I realized that my kids' lives were potentially at stake as they entered into more sexual activity. It was hard. It was a very hard time. And we were doing science, including that on the virus, that led to people quitting the organization because they were so afraid, led to a lot of problems, and to people dying, of course. So people have lived through tough times before, and whether they be wartime or serious health threats, we've made it as a nation. We're going to make this too. It's rough. It's really rough. But I think the American public and globally, we've seen such wonderful leadership globally. We can do it. We have to think positive.
Yeah. And
Sudeep, any thoughts on how to deal with that frustration that people are experiencing right now?
Yeah, part of it is setting a tone from the top. People are willing to sacrifice. They're willing to make changes in the way they live if they are convinced of the value of doing it, and that there is a plan for getting to the end of this particular tunnel.
Yeah.
And that comes from leadership. It comes from the top, saying that we see this is the path to getting to whatever the next normal is. And we have to have that clear vision for that and a clear plan for that. Without a plan, that's when the fatigue really sets in, because what started off as 14 days locked up in our house didn't seem so bad. Going on 6 months and without end, that's when the frustration really sets in. The other piece from the scientific point of view is for us as scientists to take this into account in the advice that we're giving. We have to be realistic about the world around us and make sure that we are giving advice with the proper caveats of what is possible and what we're asking. We can't ask for everyone to live in a bubble suit. We have to be able to ask for how do you live in the 21st century with all the technology that we do have in the best and most safe way possible.
I couldn't agree with you more, Sudeep, that we really need leadership and those who will sit us down and say, look, we can get through this together, but we have to listen to the science and we have to follow the guidelines collectively. There are just so many disparate messages out there. Sudeep and Mary, thank you so much for taking the time to be with us, and continued success on your advocacy. Thank you so much.
Thank you.
Great to talk with you, Lisa. Bye-bye.
Bye.
Now, you are watching The Road to a Vaccine, and as always on this show, we welcome your questions, so please put them in the comment section. We'll do our best to get to them. And since we're talking about advocacy today, we talked with an emerging leader in the fight to destigmatize mental health and provide resources to those who are struggling. Elise Fox is the founder of Sad Girls Club, an organization that creates space for the mental health needs of women of color, and here's what she had to say.
When I was a young girl, I didn't have the language to discuss what was going on in my mind. I couldn't really speak about my emotions freely, and I don't want that to be the norm for any other family. We have the power to speak up, we have the power to create these spaces, and that's what I did. Sad Girls Club is a nonprofit organization that focuses on the mental wellness of Gen Z and millennials with an emphasis on women of color. I feel like the best word to describe mental illnesses is a feeling of isolation and loneliness. So Sad Girls Club was created to combat that. We're working to remove the stigma that surrounds mental health in general and build a better future and provide language to a younger generation. This isn't something that is taboo or, out of the ordinary. It's completely normal to have mental health issues. It's completely normal to speak out about your mental health issues. It's not normal to hide something that everyone is experiencing. There's still a lot of work that needs to be done within the mental health community, specifically for communities who are marginalized. The cost of mental health care is very inaccessible, and that needs to end. Sad Girls Club was a really big in-person community, and due to the COVID-19 pandemic, we had to completely shift to digital support. I can only imagine the spike of mental illnesses that have peaked during this time. So I want to be a preventative force with Sad Girls Club. I don't want to be a reactive force that is doing cleanup. I want to make sure that we are there doing the work while the work needs to be done and not after when something bad happens. I want to help people before they become lost. So we're their guide to their mental health journey, and I'm happy to be a part of such an amazing community.
And that was Elise Fox of the Sad Girls Club. It's clear we're facing an even larger mental health crisis as a result of the pandemic, but it's heartening to know that someone so young is looking out for us and guiding other young people and women of color during this difficult time. Our next conversation is focused on advocacy by creating awareness through communication. I want to welcome back to the show a true thought leader and champion of science, Seema Kumar, VP of Innovation, Global Health and Policy Communication at J&J, with whom I have had the pleasure of working on this series, and nonfiction author and Oscar-nominated documentary filmmaker, David France. You may have seen his 2012 film, How to Survive a Plague, about the activist group ACT UP that raised AIDS awareness through a series of protests that resulted in social and political change. Seema and David, welcome to the show. Now, Seema, in many ways, this show, Road to a Vaccine, is your brainchild. You have been adamant about wanting people to be as educated as possible about this pandemic and the process of vaccine development, because you believe that the more informed we are, the better decisions we make. So why is this such an opportune moment? I mean, I imagine at a time when there's so much conflicting information, this idea of educating people is more important than ever.
Yeah, Lisa, first of all, it's great to be here, and it's always a pleasure week after week to work with you on the show. It's just phenomenal. And hi, David. Good to see you as well. So, science, as we all know, impacts our daily lives in so many different ways, from the time we wake up to the time we go to sleep. And yet people don't realize the impact that science makes. And so this particular moment is a teachable moment for us to take science, which typically happens behind the doors of a laboratory in the ivory towers of science, to the front door of people, and to the iPhones of people, to the television sets of people, and to the computers of people. And I think this moment is a teachable moment because we understand that science actually not only impacts our daily lives, but that, if you don't pay attention, it actually could have deleterious consequences for your own health. And so this is why I think this is a teachable moment. And just like with HIV/AIDS, and David and I, we went through this, David, that was another public health emergency. I think now more than ever, science needs champions, and the story of science needs to be told.
Well, Seema, I appreciate you pushing this agenda to educate people about science. I mean, I myself don't have a science background, but through this show and attention to the science, I have just learned so much, and I feel so empowered as a result. And I hope that more people begin to feel that way. David, welcome to the show. Now, your 2012 film, How to Survive a Plague, is about a group of activists who use science to advocate for effective treatments in the fight against AIDS. Why was patient advocacy such a game changer in that movement? And are there people as fired up about this fight against COVID now?
Well, thanks for having me, Lisa, and great to be with you, Seema. I've been watching the show since episode 1, so I'm a big fan. You know, HIV/AIDS came at a time when patients had very little voice in their own medical care, and certainly no one had ever seized a voice in research for medicines or any sort of approach to an illness prior to HIV/AIDS, and it was essential at that point because so little was happening, frankly. The pharmaceutical industries were not stepping up the way we wanted them to step up. The NIH wasn't stepping up the way we wanted them to step up, and years went by, frankly, before any real traction was seen toward research into, any way to take care of people with HIV. And that was really the birth of this citizen science activism that we see now in so many places, and we've seen it even embraced by big pharmaceutical companies and small biotech companies, and certainly the NIH. Now it works in concert and just about everything with patients affected by the disease. It's given a voice to people in their own care and in research for treatments for their illnesses. And that really changed everything about science and changed everything about medicine. It was a really phenomenal breakthrough, and in fact, an essential one, it turned out, for the research into the breakthrough medications that came about in 1996, which was 15 years after HIV was first described, that made it possible to survive the infection. So it looks like, certainly as COVID is rolled out, and I think Seema knows this really well firsthand, that the patient advocacy and the instruments of patient advocacy are solidly in place, and the voices are there to be consulted and listened to in this pandemic. So I think we've really come a really long way.
And how do you think that crisis? Oh, I'm sorry, Seema. How do you think that the AIDS crisis informed this current crisis? Because Dr. Fauci certainly played a pivotal role in the AIDS crisis, and while our overall response to the pandemic, this current pandemic, has been very slow, the attention, the resources that are being poured into treatments and vaccine efforts have been pretty astronomical.
That's the case. Oh. Totally the case. Yeah. And go ahead, Seema.
Sorry.
No. I was just recalling back. I don't know if you remember, David, those days in the 1990s. I was a young intern at NIH, and I remember AIDS activist patients actually, banging down the doors and demanding that they sit down with Tony, with Peggy Hamburg. And I remember the time when the doors did open and patients were invited in. And that actually changed the game for HIV in the field of HIV, where patient voices became an integral part of how you did research and development, how you develop those treatments, how you price those treatments, and how quickly we could accelerate those treatments. And which I think that's sort of a little bit of what we're seeing now is sort of the lessons learned from that era, where now we don't have to wait for those doors to be people to be banging down the door. We've already begun this journey to do this at an unprecedented pace because, patients are waiting, the world is waiting for treatments, for vaccines, for prevention of COVID. So I think we've learned our lesson, and I think the advocacy instrument, as you said, David, is fully in place thanks to the experiences that we went through during the HIV/AIDS crisis.
Also, as you point out, so many people who were there in HIV/AIDS are there today. I mean, we have a whole bench of people who came up through HIV and learned those lessons and learned that science could be nimble and ethical, moral, and that it could move quickly. That's and should move quickly, and that it's not simply an academic pursuit. And that, I think, seeing so many people like Tony Fauci, like Deborah Birx, like so many people on your team, Seema, and so many people across the board who we know so well from that period 35 years ago, and seeing them use those lessons and reach out even actively to the patient population to bring them on as partners in this is really the legacy of AIDS.
Absolutely.
There were certainly so many contentious moments throughout the AIDS crisis. One of the big differences between that crisis and the one we're in the midst of now is we currently live in a culture where things go viral almost instantly. How has that both helped and hampered the efforts to promote science?
No, I think social media is a blessing and a curse. So on the one hand, it's a blessing because the immediacy of important information is communicated to the public ASAP. And you hear it not just from experts and, from the powers that be, who choose the time when to communicate, but you hear it real time from your friends, from your family, from other people just like you. So in that sense, it's, I think, great. But also, I think on the flip side, what can happen is that before the expert voices come in, if these voices that are sort of the lay voices do not share the proper right information, then that could be a disservice in the sense that something could go viral that is actually misinformation or disinformation. And so it behooves us, all of us, that to use those things as flags for us to go and find out more information, to actually go to the internet, to look up what the experts are saying. So to use it as sort of an early warning system rather than as, actually the facts. David, what do you think?
I was going to actually ask a question from someone from LinkedIn who asked something similar. How can we use social media to promote things like vaccine development and the benefits of vaccines?
Well, and at a scary time too, right? I mean, the social media, as you point out, Seema, has been packed with disinformation, especially about vaccines. And we've seen the anti-vax movement, which is based in so little, grab so much. We're at a period where the suspicions about a vaccine, this vaccine, the one we're all waiting for, is at an all-time high. And I think we just have to, first of all, make sure that science is in the lead, not politics, not opinion, but science itself. And I think that we need to work together to build a bulwark against that disinformation and protect science from all the many ways that it will be challenged in the coming months.
And what are ways we can do this? I mean, we talked in the previous segment about how young scientists are now wanting to raise their voices and be more, I don't want to use the word transparent because it's not like they haven't been transparent. They just haven't been on the forefront of conveying information. Seema, I know that's been an issue for you too, which is why you wanted to do this show so that we could sort of peel back the layers, open the curtain so that people could better understand the processes by which, for example, vaccines are being developed.
Absolutely, because, science seems to be mysterious and sometimes, people cannot relate to it. So we really do need to pull back the curtain and show how science is done. And we need more young people showcased. And as you remember, Lisa, we had a young scientist who is actually designing the vaccine on our first show. And the level of engagement we got, and people could relate to her. And so similarly, I think from an advocacy perspective, from a communications perspective, we of course need the Dr. Tony Fauci's and Dr. Deborah Birx's and Dr. Peggy Hamburg's who were there during the AIDS era, but we also need the new Greta Thunberg of COVID. We need the young voices to be out there, to actually, take a stand and to communicate to people like themselves, because as we know, people relate to people like them. And so that kind of advocacy is something that I think we should encourage and create a movement. And I think that will help to bring the next generation of leaders into the mix as well.
Such a smart observation. I wonder, have you seen that at all, Seema? Have you seen the Greta Thunberg of COVID present herself to us?
Not yet, but there are many others who are sort of Greta Thunbergs in the making. And I think that there are young, one of the pieces of disinformation or misinformation that has been around is that young people are quote unquote immune to COVID. And very quickly we found out that that's not the case. And those who are actually surviving, recovering from COVID have realized this and are taking up the mantle to say, hey, listen, I'm here to tell you that I am young and I got COVID and I thank God I survived it. So, make sure that you're being careful and taking all of the precautions, because until a vaccine comes, all we have are masks and social distancing and, careful CDC guidelines that we all have to observe. Right?
I don't know if you watched the Democratic convention last night, but there was a young woman who talked about losing her father to COVID, and she was pretty forthright about the fact that her father was not someone who trusted science. So certainly that was a moving moment. I have a question from Ashish from LinkedIn, who asks, how can world leaders emphasize science-based invention rather than other influences? How can advocacy help and educate leaders and the way they make decisions? David?
Well, if I knew the answer to that, I would fix everything. I think one of the things we should be demanding is a stronger media. We have Russia now claiming that they're rolling out an effective and safe vaccine, and that gains headlines repeatedly around the globe. China is doing the same. Washington is sometimes doing the same, depending on who you talk to and depending on what day. And I think we need to measure those statements against the science and put science in the foreground in all the reporting that we do, and hope that there's somebody who's filtering this information for us. It is a political free-for-all in a way that I think is fueling the suspicions that people have about science itself.
Do you have any thoughts or suggestions as to how to better differentiate between valid scientific information and so much of the misinformation that's out there, David?
Well, it's the science itself, right? So, science exists in an area of uncertainty for the most part, where we don't know anything until we know it. And I think that we just have to remember that and to talk about that and to remind ourselves that in the absence of scientific conclusion, it doesn't mean that political conclusions can stand in. And it's a hard lesson to learn, and certainly right now where everybody is feeling so powerless and so disenfranchised because of the pandemic, that it's a message that just needs to be repeated in a way that actually becomes the dominant message.
I have to ask you both about how disproportionately affected communities of color have been by COVID, and yet it's people in the same communities who are distrustful of science and even opposed to the idea of vaccines because of past medical exploitation. So what do you think needs to be done to change those attitudes?
Yeah, I think that it is terrible to see the disproportionate impact that COVID is having on communities of color, and yet you could also understand there are trust issues from decades and centuries of racism and biases. That distrust has been created where whether it's doctors or medical people or frontline healthcare workers, you typically trust the types of people who actually look like you. And so there, I think we have a lot of work to do. And then, historically, things like the Tuskegee experiment and things like that have also created, centuries of distrust. And so as a result of that, we need to work a lot in creating that trust. But it all comes back to science and education about science. And even the previous question you were asking, Lisa, and to David's comment is, how do you sort of separate facts from fiction and information from misinformation? And I think one of the things that we lack as a society is the critical thinking, the science education, the basic science education that we need that will allow us to actually separate the wheat from the chaff. And on the flip side of it, I think science education should be a part of the curriculum, a must-do curriculum, a required course for all citizens. And on the flip side, I think for scientists, we should require that they do a course on communication so that they can be better communicators and talk to people in just people language and not, scientific language.
David, you are a journalist, but would you say that you are an advocate as well? And why do you think journalism can be such a powerful tool in advocating and creating change?
Well, as a journalist, I am, fact-based, and that's my advocacy, I guess, is for the facts. However, I have spent a good portion of my career covering activism, covering the ways that ordinary people change the system through organizing, through militant behavior, sometimes through education of the kind that Seema's talking about, through self-education, through self-empowerment, and so I guess I've dedicated myself to studying how that works and what those tools are and how they get either accepted or rejected, and how ultimately they are an essential part of moving forward. And we haven't talked about this much yet, but there hasn't been the same kind of activism in COVID that we've seen in HIV/AIDS. Part of that is because so much of what's going on is behind closed doors. So that's why it's important for programs like yours to open that up. And so many people are still locked indoors themselves and unable so far to find a way to express their voices. The movement for Black Lives has done an incredible amount of work. They were already on the ground for many, many years, as we know. So they had built a momentum and an infrastructure and a presence in cities across not just the US, but the globe. So when it comes to the kind of healthcare advocacy that is going to be an important part of this project of getting us out of our homes again and getting us more safely in community with one another, I'm hoping that we're going to start seeing some real innovation on the part of ordinary citizens to help us get there.
David, that's such a great point to end on, the need for scientists to start speaking out more. And already we're seeing so many, almost 7 months into this crisis in America, exercising their voices, because this current predicament that we're in, it just didn't have to be this way. We didn't have to be this far into a crisis and still, with no end in sight. So thank you, David France, for taking the time to be with us. Seema, as always, thank you for being with us on the show today and just constantly pushing the envelope and trying to communicate how grounded we need to be in science. Thank you both.
Thanks.
And now we have another very powerful clip for you. We're going to hear from several young women fighting for the rights of people with disabilities: Anastasia Somoza, Carolyn Casey, and Sean Horn. Take a look at this.
My name is Caroline Casey. I'm Irish and the founder of the Valuable 500.
I am an international disability rights advocate, speaker, and consultant. I began this work with my twin sister, Alba Somoza, who has cerebral palsy as well.
I walk the world with 2 shiny ski poles. My disability advocacy really began when I started running workshops on beauty and self-esteem for girls and women and people with disabilities based off my own experiences. It expanded my entire world.
So I do think we've achieved a lot in terms of making our world more accessible, but we also have a long way to go. Without home and community-based services, I can't maintain a healthy, happy lifestyle, whether we're in a pandemic or not, in order to keep myself alive and happy and out of a group home and a nursing home.
I fundamentally believe in the right for each of us to belong equally and uniquely as ourselves. And I believe in the power of business to create an inclusive society. And I believe in the power of business leadership to make that happen. That has been my obsession.
We need to get past just legislation and policy, but for really go beyond diversity, which makes us more complete, and inclusion, which invites us into the room, but truly and utterly go for a deep integration where we realize we need each other and we can work beautifully together, much more beautifully together than apart.
When we get to the point that we see disability as inherently human, I think we will have achieved something spectacular. And we've come a long way, but we're not there yet.
Such passionate young voices fighting for disability justice, young women who are truly changing the world. I want to thank all of our guests today for the great work they're doing and for being on the show. And I want to thank all of you for tuning in. My biggest takeaway from our conversation today is that advocacy really plays a key role in times of crisis like the one we're in now. We can gather all the data we want, but the only way to successfully improve our public health is by taking action ourselves. With COVID, we as individuals and communities have the ability to participate in the prevention of illness and disease and death as well. And while scientists work to develop vaccines and governments race to slow the curve, we're all learning new information about this virus and its effects on a daily basis. We just have to listen to the voices of patients and healthcare providers and scientists above all, and continue to advocate for health for all communities, because by doing this, we truly can save lives. Thank you all. We'll see you next week.